Hi everyone, welcome to the weekly joint health talk series held by Heartland Rehab SG. Going to just touch on a little bit about how splinting can help with peripheral neuropathies today. I'm going to just do a little bit of introduction on what is splinting, just so that everybody is on the same page. So splinting is actually made up of thermoplastic materials like this. They come in the raw form like that, colors for aesthetic purposes. They are actually thermoplastic materials that changes its properties according to heat. So together with a hot water bath, we can actually sort of like make it softer and then mold it on the patient's hands, or our client's hands, into shapes that we want to. And then when it cools, it will harden to form splints, for purposes that we want to immobilize. So for example, like this in the pictures, we can immobilize the elbow or the fingers in accordance to what we want to immobilize. So how do we actually do the splint? So actually we will do some measurements and patterning, and then we'll place the material inside the hot water bath, and then it starts to soften, and we cut it according to the shape that we want to, in accordance to the pattern that we have measured. Place it back, make sure that it's warm and soft. And then we will place it on the client's hand. So the material is able to conform to the shape of the client's hand in totality when it's actually very soft. So we'll wait for the temperature to cool down, and then it will harden into a shape that we want it to. So when it's actually cool enough, we'll mark out the areas that we do not want to have on the splint, the excess materials and so on and so forth. And then we will cut off the excess. And then make sure that there are no rough edges that will cut onto the client's skin. Place it back on the client's hand to make sure that whatever we want to immobilize or keep in place is accurate and does not cause any pressure areas. And then we will place the velcros on to hold it in position for the client to actually wear it as per what is instructed by the doctors or the therapists. So now that we know how the splinting is done, I'll touch on a little bit about peripheral neuropathies first. So firstly, we'll talk about carpal tunnel syndrome. So this is a cross section of our wrist, and that's where the carpal tunnel is. There's a red arrow there which actually shows the median nerve, which is the culprit in action for the carpal tunnel syndrome. So this is a very normal wrist where there is no compression of the nerve, so it looks nice and round. But if it is compressed, then it will look something like that, and then it will give off symptoms that contributes to carpal tunnel syndrome. There are a few symptoms that are very classic of carpal tunnel syndrome. The median nerve is actually responsible for giving sensations over our thumb, our index finger and our middle finger. So when the median nerve is excessively compressed due to whatever reasons, then it will start to give off numbness and tingling sensation over the thumb, the index finger and the middle finger over at the palm area. Some clients will also find that they have the tendency to drop items that they are carrying because of the weakness of the muscles involved. Then they'll drop it because they can't control the first three fingers. So what are the common causes of carpal tunnel syndrome? Basically stems from repetitive wrist movements and awkward wrist movements like that, and like this. So some people will like to do this often, or some people will like to do this often. So for waiters who need to carry the trays like that, this is called prolonged awkward positions of the wrist. So this will result in the compression of the carpal tunnel, and then it will compress the median nerve as a result. Other causes of the carpal tunnel syndrome could be the use of vibrational tools. So for our construction worker friends who constantly have to use the tools, vibration, it will contribute to the compression of the carpal tunnel as well, which leads to the nerve compression. There are also the professional musical instrument players. So people who plays the cello or the guitar, they have to keep putting their wrist in this kind of position. That will also contribute to prolonged bending of the wrist. Then of course the compression of the nerve. Usually for carpal tunnel syndrome, we will do splints like that. Okay, so it basically keeps the wrist in a very nice position and prevents it from bending too much either backwards or forwards. The purpose of this splint is actually to act as a deterrent for too much wrist movements, or it could actually provide it as a form of forced rest to the wrist so that the nerve can be allowed to rest. Yeah. Okay, so the next one we will talk about is cubital tunnel syndrome. Okay, so the cubital tunnel syndrome actually results from the ulnar nerve being compressed, as highlighted in yellow. So this nerve actually sits nicely on the outside of the elbow, on the superficial surface of the elbow. So this nerve is actually responsible for the electric shock tingling feeling that we all feel when we accidentally knock our elbow against hard surfaces. Yeah. So some symptoms of the cubital tunnel syndrome will be numbness and tingling sensation over at the 4th and 5th digit of the hand, because that's what the ulnar nerve supplies. So it also actually causes a bit of numbness and tingling at night especially, and there are some hand pain over at this area, and weak grip on like plastic bags. This cubital tunnel syndrome will occur when there is overcompression of the ulnar nerve, or there's another reason is when there is excessive bending of the elbow. So that will cause inflammation, and that will decrease the space in the whole elbow area and therefore compress the nerve furthermore. So what are the common causes of the cubital tunnel syndrome? Basically more of things that decreases the space of the elbow. So we are talking about bone spurs, which are tiny bone projections within the joint. They will grow inside the joint, and then it will cause increased pressure over the nerve. Okay, so some people like to sleep like that with their hands overhead, or maybe when they are resting at their office desk, they like to do that. So then they will realize that there will be a lot of tingling sensation that start to come about in the 4th or 5th finger. For professional gamers, they usually do the controller with their elbow in flexion, and they game for hours. Then, so for splinting wise, for cubital tunnel syndrome, we will actually prescribe a splint that looks like that. It will prevent the elbow from too much flexion. Okay, so the next one we'll talk about is the radial nerve neuropathy. Okay, so the radial nerve actually controls our hand, the back of our hand, from the arm all the way to our fingers. Okay, so depending on which points of the radial nerve has been injured, there are various classic symptoms according to where the locations are. So let's say if the injury is at the armpit level, then there will be some weakness of the big muscles of the hand, and there will be tingling and numbness sensation all the way down to the fingers. If it's at the elbow part of it, then there will be what we call the wrist drop, where you can't actively bend your wrist backwards like how you do a waiter pose, and you can't actively open up your fingers at your knuckles level. Some common causes of the radial nerve palsy, one of them actually includes the fracture of this bone over here, which is where the nerve spirals around. So if there is a fracture here, then the nerve will definitely be injured. Okay, then there's another one, is what we call the honeymoon syndrome. Okay, so basically they are talking about couples who actually lie, the ladies that lie on the shoulder of the man when sleeping overnight. So it's long hours, so there's a prolonged compression of the radial nerve at the armpit. Yep. So the other one is actually the Saturday night palsy, also called the alcoholic syndrome. Okay, so it's falling asleep with the hand at the back of the chair like this. Oops. At the back of the chair like this. Okay, so because they are drunk and they don't know what's happening, so they fell asleep. So it's in a prolonged hours of position as well, so it's also at the armpit level injury.